Hello, people. So, if you're new to my channel, my name is Dr. Shabaz Ansari, and yet here I am with another video. So, I just want to share one mock that I arranged as a free session, and there are three cases, and there was this wonderful doctor who asked to volunteer. So, yeah, it might be a bit of a long video, but it's really good and it's worth watching. So, please watch it and let me know how it is. Yeah. So I've started the recording now, and let's just give you one station, Dr. Linda. I'll give you 1 minute, a 30-second to 1 minute time to read the station and go through it. And I'll start the timer, and I'll give you around 7 minutes and 30 seconds, around 8 minutes to prep it. Okay.
All right. Yeah. Thank you.
Okay. Perfect. Do you have any preference in medicine, gynae, or peds, or should I just go random?
No preference. Yeah. Up to you.
Yeah. Amazing. Okay. So can you see the screen properly?
Yes, I can see it.
Yeah, so this is your case. You're an FY2 in GP. Angela, age 22, presents to the clinic to see you about her problem. Please talk to the patient, take relevant history, and assess the patient and discuss about the plan of management with the patient. Well, there's nothing given as per se, so I don't think so you need 1 minute to prepare. Or do you need 1 minute?
Yeah. 1 minute.
Okay. Should we start?
Yes.
Okay, amazing. Okay.
Hello. Hello.
Hello.
I am Dr. Bilal, appointed doctor in the GP clinic. Can you confirm your name?
Yes, my name is Angela and I'm 22 years old.
Okay. What would you like me to call you?
Angela.
Nice to meet you, Angela.
Nice meeting you too, doctor.
How can I help you?
Oh, well, doctor, I'm having these issues. I thought I should talk to you about them. I'm gaining a lot of weight for the past couple of months.
Okay. Could you tell me more about that, Angela?
It's just that I'm gaining a lot of weight and I feel that I'm getting it a little slow. It's people say that I'm lazy, but I don't think so. I'm lazy. I just feel that I'm getting a bit sluggish.
Okay, I am so sorry that you are experiencing this symptom. Yeah. Could you tell me when it started?
It started a couple of months. Just adjust your mic a little.
Sorry, because the sound was a bit interrupted from my side. Sorry if I am going to ask you another question.
Okay.
Yeah. So you told me that you are gaining weight, yeah? Could you
yes.
tell me how many kilos?
Well, I've not measured it as per se, but my clothes that used to fit me a couple of months back are getting really tight.
Okay, you are tired as well, yeah? Anything? Yeah, anything makes you worse?
I don't know.
Anything makes you better?
I don't know. Just the gaining weight is the issue. I don't think so. Anything's. Okay. I don't know.
Is that affecting your mood in any way?
Oh yes, doctor. I just feel low all the time.
Okay. Your mood, please, from 1 to
10. It's maybe 7, 6.
Okay. Do you feel sometimes like cold when people feel hot, or feel hot when people feel cold?
Oh yes, I do feel cold. When other people are fine and I'm just chilly.
Okay, I can see. What about your concentration? Are you able to concentrate in any task?
No, doctor. As I mentioned, I just feel low all the time. I don't have the zeal to work. I was very cheerful once upon a time, but I don't know what's happening.
Okay, that must be frustrating, Angela.
Yes, it is.
Do you have any specific concern?
I just want to know what's happening.
Okay, you did the right thing to come into the GP now, yeah, and raise this concern with us. I will do my best to address your concern by the end of my consultation. Is that okay?
Yes, that's really good. That's fine.
Okay. So now I would like just to ask you a question about your general health. Do you have any medical condition?
No, doctor.
Okay. Are you taking any medication?
No.
Do you have any allergy?
No.
Have you noticed any swelling in your neck?
Yes, I do feel some swelling, but I cannot pinpoint.
Yeah. How is your appetite?
I'm sorry?
How is your appetite?
Well, it's to be honest, it's very disturbed. I used to have some appetite, but now I just don't feel that hungry.
Okay. In your family, anyone has the same symptom like you?
No, doctor.
No. Okay. Anyone has like a long-term disease?
No.
Any problem with the gland in the neck?
No.
Okay. So now I would like to ask you some few questions about your lifestyle habit. Smoke?
No.
Do you drink alcohol?
No.
Okay. So how about, what do you do? You told me that you are a teacher, no?
You never asked me, doctor, but yes, I am a teacher.
Oh, sorry. So I guess that.
Absolutely fine. Absolutely fine.
Sorry. So who do you live with?
I live alone, doctor.
Okay. So at this point, yeah, I would like to examine you. Yeah. Check your observation, check your temperature, your blood pressure. And also I need to check your weight and height. Yeah.
Okay.
And examine your neck. And listen to your heart. Okay. And do a general physical examination. Is that
anything else, doctor?
Also, I would like to run some investigation. Yeah. Some blood test.
Like what, doctor?
Full blood count. Yeah. And thyroid function. Blood sugar.
Okay.
And yeah, and to check also the function of your liver.
So
and
these are the results, doctor.
Okay. Okay. All right. So Angela, from my assessment, yeah, from my assessment at what you have told me and the result which I have now, yeah, I am suspecting you have a condition you have a problem with the gland which is in your neck, yeah, called the thyroid. It might be hypothyroidism.
Okay.
Yeah. For
what
this
is that, doctor?
It is a problem with the level of the hormones, yeah, which secreted by this gland, which is located in the neck, yeah. This hormone we need this hormone for to control the weight sometimes, to control the rhythm of the heart, yeah.
So what you're going to do about it, doctor?
Say again, sorry.
What are you going to do about it, doctor?
In your case, yeah, I should involve my senior, yeah, prescribe you some hormone, yeah, called thyroxine, just to give you like the amount needed for your body.
Okay.
Yeah, and you need also a follow-up, yeah, a regular follow-up to check the blood test in a few weeks, yeah, to see if we can adjust the level of the treatment, I mean the dosage of the treatment or no.
Okay.
Yeah, are you following me?
Yes.
Yeah, do you have any questions so far?
No, doctor.
Okay, so at the meantime, if you feel like your mood is very low, yeah, and you are not able like to do your everyday tasks, please, you can contact us immediately. We might offer you some support for that.
Move on to the next station, doctor. So how was it?
I don't know. I tried to divide my station half-half. It's like data gathering and managing the time and management, but I couldn't because when I was still in examination, I had that only 2 minutes remaining.
Yeah. Okay. So should I give you a review right now?
Yeah, of course.
Okay. So in IPS, you're really good. So you don't have to work a lot on that, but it's just that let the patient speak. And do not give a lot of leading questions, because if you're giving too many leaded questions, you'll just get one word answer. Do you have this? Yes. Do you have this? No. Do you have this? No. Just let him or her speak. Okay, can you please tell me more about it? A bit more detail. Maybe is there something else you want to share with me? Open-ended questions. It was pretty evident that it was hypothyroidism.
Yeah.
Right? And you could have asked me about any pain, any other thing, but your history was very, very sufficient.
Yeah.
Okay, the only thing that could have been made better was merely the management part, because once you're actually switching from the data gathering, thanks a lot for telling me all that valuable information. Now I would like to go towards my examination. I would like to examine you, do a general physical examination, and this is something which you need to do by heart. This is a statement that will go whatever the case is, right? So just keep talking, because he or she will be listening for that particular statement. That for example, I was waiting for the thyroid function test.
Okay.
Right? So whenever you say that thing, he's going to give you that result.
Okay.
Yeah. So just cram it down that I will be performing a general physical examination, taking your weight, doing your vitals, and a part of that, I'll like to order a panel of investigation, which will include this, and that. So if he hears something which is significant, he's going to give you that result then and there.
Okay.
Once you see it, okay, so it's hypothyroidism. Just go and tell him the diagnosis. Tell him or her the diagnosis. Okay, from the results that we have gotten and from the history that you've given me, we might be suspecting something called hypothyroidism. Give them that diagnosis. And because English is their primary language, they know what thyroid is.
Okay.
If they ask you what is that, then explain it further. Do not explain it before giving him or her the diagnosis, because it's going to waste a lot of your time, to be honest. Okay, so you don't have to tell him, okay, there's a thyroid gland which is in the neck, which gives. Simply give it him in a nutshell diagnosis. Okay, what you're suspecting is hypothyroidism. Pause. Do you want me to tell you more about it? If he or she says yes, then explain it in a nutshell. Like, okay, this is a gland which is present in the neck, and it is really important in secreting some hormones which are very essential in the daily life activities. So this also gives you the whole portion.
Okay.
And yeah, just find easier ways to simplify your statements. It saves a lot of your time.
Yeah.
Because you have to tell him about the medication, for the testing, follow-up, senior involvement, lifestyle modification, everything. Okay?
Yeah, thank you very much.
Yeah, no problem. So far, the data gathering was nice, but a lot of people actually struggle with the management part itself. So I just try to improve. Just shorten a little bit of history. Once you get the diagnosis, just skip the history. And just fast forward the history. What she does for a living, it doesn't matter when she's having hypothyroidism. Unless there's an allergen or toxin you're suspecting. I didn't say any. Okay.
Yeah, I put to skip some question. Yeah, from
what she does for a living and who she lives with. If there is not a reason to find out who she lives with, if I say that, oh, I'm very depressed, then maybe that thing might be included or might have some points. Okay. You just skip on question, but that comes with time and practice.
Okay. Yeah. Thank you very much.
No problem. So yeah, I've got one more station. Anyone else wants to practice? And if you have any question, please ask away, because the more this session is interactive, the better it is for me and for you as well. Because to be honest, I've cleared my exam. So this is all for you people. Give you another station. Okay. So you are FY2 in OBG, Pamela, age 29, who is 36 weeks pregnant, has been referred to the hospital. The midwife has seen the lady and made a note, vitals are whatever. Discuss your further management with the patient and address her concerns. Yeah, I'm going to give you 30 seconds to just read it away and think what questions you will be asking. And just remember what we did right now.
Okay, yeah.
Yeah, you're allowed to make mistakes, but yeah, make new mistakes. Don't repeat the earlier ones.
Yeah, I hope that.
Yeah. Yeah. 30 seconds are up. Do you want me to close this, or I'll just give it give this again to you again once you're at that part. Okay, let me just start the timer.
Hello.
Hello.
I am Dr. Banuda, an equal doctor in the department. May you confirm your name and age, please?
Yes, hello, doctor. My name is Pamela, and I'm 29 years old.
Okay, nice to meet you, Pamela.
Nice to meet you too, doctor.
I understand that you are pregnant, yeah?
Oh, yes, I am 36 weeks far.
Okay, how is your pregnancy so far?
Well, it's going so far so good. It's just that I've been going to my pregnancy clinic regularly, but today my midwife actually noticed something and she just referred me here. So yeah, here I am.
Yeah, do you know why she referred you to this hospital?
She was telling me something that there is something fishy going on. So yeah, it's better that you check it up with the doctor. And yeah, I didn't understand what she said, to be honest.
Okay, okay, I will explain you everything, Pamela. So, have you been seen the midwife or the pregnancy? Have you attended all the checkup till now?
Yes, doctor. Yes, doctor. As I mentioned, I've been going to the clinics regularly, religiously, to be honest.
Okay. Do you have any other children?
No, this is my first child.
And this is the first pregnancy?
Yes.
Okay. So, Pamela, do you have any headaches?
Oh, yes, doctor, I do.
I would like to ask you, do you have any headaches?
Yes, I do have some heaviness on my head sometimes.
Any tiredness?
Sorry?
Any tiredness?
Oh, yes. Yes, I'm tired all the time.
Okay. Any visual problem? Any visual problem?
No.
No, all right. So Pamela, as you told me that the midwife have already sent you to the hospital because she found that you have a high blood pressure, yeah, which was not shown from my note. I can see that your blood pressure in the beginning of the pregnancy was completely normal, yeah, and also she found that you have some protein in your urine.
Okay.
Yeah. For this reason, she sent you to the hospital, yeah, to check your health and to check the baby as well. Yeah. I would like now just to ask you a few questions about your general health. Is that okay?
Sure.
Yeah. Do you have any medical condition?
No, doctor.
Okay. Are you taking any medication?
No.
Okay. How about folic acid?
Yes, the doctor before my pregnancy did advise me folic acid. So yeah, I'm taking it.
Okay. Do you have any allergy?
I'm allergic to peanuts, doctor.
All right. Thank you for telling me. Do you have any surgery in the past?
I've not had any surgeries. No.
In your family, anyone has like a long-term disease,
No.
like kidney problem, heart?
No. Well, my mother actually had some issues with during her pregnancy, but I do not know the details.
Okay, okay.
Yeah.
And now I would like to ask you a question about your lifestyle.
Mm-hmm.
Do you smoke?
No.
Do you drink alcohol?
Well, I used to, but since from the moment I got pregnant, I am not drinking alcohol anymore.
Okay, well done. You did the right thing, Pamela.
Thank you.
How do you describe your diet?
Well, I try to eat everything, and I try to maintain a balanced diet.
All right. And are you physically active?
Well, pregnancy has limited me, but yeah, I try.
May I know who do you live with?
I live with my husband.
Okay. How is everything at home?
Everything's fine.
All right. So now at this point, yeah, I would like to check your blood pressure as well. Yeah. And check your weight and do a physical examination, examine your heart and do examine your nerves as well. So Pamela, from my assessment, yeah, and because you are pregnant and now 36 weeks, yeah, we are suspecting that you have a condition called pre-eclampsia.
Okay.
Have you heard about it?
Well, there's a friend of mine who got pregnant and she had similar condition.
Okay.
Yeah, but I'm not really aware. Could you please tell me more about it?
Yeah, of course, yeah. So pre-eclampsia, it is like when the woman, is pregnant, she can experience some complication. The blood pressure could get high, yeah, and we can have. She had like some protein in her urine, yeah. Sometimes the cause is unknown, yeah, but sometimes is due like if there is any problem in the kidney. Yeah, sometimes if the pregnancy is, we have like twins, yeah. Yeah, are you following?
Oh, yes, doctor, I am.
Yeah, so for your case, maybe it is, you told me that your mother has this condition before. It could be related to that. And because it is the first pregnancy, yeah, it could be that this is the reason. But it
So
is
what
not,
are you going to do about it, doctor?
first thing, we need to admit you to the hospital, yeah, to check you, to monitor you regularly, yeah, to check your blood pressure and also to check your urine, yeah, if there is still protein there or no. We need also to check the baby, yeah, to check if there is check first the development, yeah, and check the flow of the the blood if there is going well from your body to the baby, yeah. And we need to do a regular monitoring for the blood pressure as well. And we need also, because the blood pressure is high, we need to prescribe you some medication, to reduce your blood pressure, and we will make sure that it is not harmful for the baby.
Anything else, doctor?
Do you have any questions so far?
Anything else, doctor?
Anything else? Because now you are 36 weeks, yeah. We might like induce if there is any problem, if you experience any headache.
Move on to the next station, doctor.
I think the same problem.
Yeah. First of all, well, I'll start from the beginning. Your introduction is really nice. It's just that since we had that earlier station, now you were trying to jump from the history too soon. You had you're not supposed to diagnose anything because, to be honest, everything is given to you in the scenario itself. It was very evidently pre-eclampsia, right?
Yeah.
But she was referred by a midwife, so you have to take a history. You have to make sure that everything is fine, and whatever there is written, she is having everything.
Mm-hmm.
Yeah, it was better that you could have taken a history, the shorter history, as much as you can, okay, and check everything if it's fine. She's eating well, and any other swelling in the legs, any dizziness, and blah blah whatever. Then you're supposed to examine her. Like, now I will proceed examination. Then explain her, because you started the management in the very beginning. Then you switched to history. Then you again went to the management. So it just hopping around. So it also confuses the patient, as well as the doctor is also confused. Okay, I was there, then I'm here, then I should go there. So it's not a systemic way.
Mm-hmm.
Yeah, it's better if once you ask the whole history, then go to the examination, then go to the management. And
Yeah.
so this is basically a counseling station. So the diagnosis is already presented to you in a plate. So you have to take a very short history and
Yeah.
a short examination, and you have to convince the patient, okay, this is what you have, and this is what you're suspecting, and we might admit you. And there are a lot of areas that you have to cover here. What are you going to do about it now? What it can lead to? It can lead to pre-eclampsia. Okay, what is the treatment? We'll manage your blood pressure. We'll keep you under observation, and and it might actually aggravate to eclampsia, which is fits. But if we take precautionary measures, you might actually prevent that condition. And we also have to consider the pregnancy. That what is the actual treatment? The actual treatment is delivery,
Delivery. Yeah.
delivering the baby. And at this point, we cannot induce pregnancy. What we can have is an emergency C-section. So yeah, there's a lot of areas to cover.
Yeah.
Yeah.
Yeah. I am following you. Yeah.
And after that, you have to advise her that, okay, do you want somebody to be with you? Do you want me to inform your husband, or do you want some time to recuperate everything? And yeah, a lot of small things that need to be done here. Because in a counseling station, the history is supposed to be short, because the diagnosis is already given to you. There is, what more thing can you ask which will change the management? Nothing.
Nothing. Yeah.
But since you've asked me, that I gave you a history that, okay, my mother also had some issues with the pregnancy. So these are small points which you can add on as a counter argument when the patient denies it. No, I don't want to be admitted. This will go away. So there you can give this positive point. Okay, as you've mentioned in your history as well, that your mother also went through this condition, so that this might be a genetically predisposed condition. So I would advise you to stay, and let me reassure you what we are doing is the protocol, and let me just involve my senior. Maybe he might be able to convince you a bit more, or let me just discuss this case with my senior.
Yeah. Thank you.
You'll have to reassure that we'll be putting you under close observation, and you're very important to us. Just make that person feel important. So yeah, he won't give you anything to retaliate. Okay.
Yeah. Thank you very much.
No problem. Just practice with the time management, and just try not to say yeah, because it feels like you're asking the question, then you're answering yourself. Are you listening? Yeah. A lot of people might actually don't like it.
Yeah, I know.
Try to practice without it.
Inshallah.
It might take time, but yeah, best of luck.
Thank you very much, doctor.
Yes, doctor, it actually does resemble with OET speaking, because there you're also consulting with the patient. You're having a conversation, and this is also a scenario where you're actually having a conversation. Every doctor is supposed to have a conversation with the patient, which signifies two people talking. One people is going to ask a question, one people is going to answer, person is going to answer, then one is going to listen, then you're going to reciprocate according to the question. So yeah, if he or she is upset, act accordingly. If he or she is mad, act accordingly. Try not to be a robot. If we are not getting to the exact diagnosis, then it's absolutely fine. Well, in 5-6 minutes, it's literally impossible to diagnose a case at times, but this is an FI2 level exam, and whatever scenarios they will give, the most probably they will be diagnosable. There are easier cases like appendicitis or tonsillitis or UTI, and you'll be expected to give a generic answer. If you're sure that this is the diagnosis, go with it. If you're not sure, do not give a diagnosis, but never give a wrong diagnosis. Yeah, it's very likely you'll be able to diagnose. Yeah. Any other questions if anybody has, because I've got like 6 minutes remaining. And I cannot obviously give a station in 6 minutes because we don't have sufficient time. Any other questions anybody has? Because if nobody has any questions, well, if I knew that I would be talking a lot, I would prepare that, okay, I'm going to talk about this content, and I would have done that. Can you guide about counseling station? Yes, I can absolutely do that. Well, as we did this counseling station, the time management in the counseling station remains like the diagnosis or the point of the matter will already be present to you, and nothing from the history you can take which will actually change the diagnosis. Like this patient that we had, she had pre-eclampsia, and it was very evident from the scenario itself. So just keep the history as short as possible, not very short, that ask the name and continue with the management. Yeah, just 2 to 3 minutes history, and rest is management. Were there stations where you didn't give a diagnosis or gave 2 diagnoses and passed that station? Well, I had 16 stations and I cleared all of them, but none of them was that difficult that I wouldn't give a diagnosis. I was a bit shady at places, but I just gave 1 diagnosis. But if you are not sure, you can give a probable diagnosis, because whatever diagnosis you're giving, it's a suspected diagnosis. And the actual diagnosis will be done by further investigations, by consulting a senior. So if you're not aware that this might be diagnosed, just give him a probable diagnosis. We might be suspecting this. And we're going to do this test in order to evaluate more. Should we study medicine too, or just practice stations with fellows? You don't have to study medicine, because the level everyone is going to be at this exam, you'll have the sufficient amount of knowledge. Maybe you have more knowledge than me right now. But if you want to just brush up your medicine, you can always refer back to the books. How to cover up then, and just say, I'll involve my senior. Yes, just say that we are suspecting one of these conditions, but I'm not sure what you might actually have. So I'm just going to involve my senior to make sure everything is fine and we don't misdiagnose you. So just glitter it up, the answer, because whatever you're doing is for their own good. You don't want them to misdiagnose. Yeah. These are all really perky things that you learn in the UK. Once you come to UK, you'll learn how to be cheeky with the words. Yeah. So I think that's about it, the question. Everyone advises to stay unscripted. What does that mean? Well, unscripted means that be natural. If you have read a tonsillitis scenario, and most of the times, if you ask the patient, okay, how may I help you, or what is the problem going on, the patient will actually blabber everything that, okay, I had this. He'll give you the whole history, and you'll be left with nothing to ask. So yeah, that is the unscripted part comes in when you are pretty much aware, and you're practicing in a natural way, that you'll be able to answer every question that there is. If they'll tell you the whole history in the first 30 seconds, what questions will you ask? So yeah, that is when the scripted and unscripted shows. Because if you are not a good listener, you'll end up asking the same questions again and again. So that signifies that, okay, you are actually running on a pre-learned or memorized script, and you have to retaliate and reciprocate with the emotions. And just saying I'm sorry with the straight fit doesn't mean anything. Yeah, just say what you feel and feel what you say. Oh, thank you, Doctor. It's my pleasure. So yeah, I think that was about it. If you like the session, do tell me so I could keep doing these things again and again. And to be honest, the more you interact, the better it is, because you'll be talking to 16 different people, as I mentioned this couple of times earlier as well. 16 different people you'll be talking for 180 minutes, and that is the first ever hurdle that you have to do. Just talk, 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 talk. Yes, I intend to. And if you have any questions, you can always write it in the group. And most of the times I try to make YouTube videos and post it on my YouTube, and I'm actually still learning. So it takes a lot of time, as I've been a geek. I'm not been a geek all my life. So yeah, I'm just learning. So yeah, I hope you like this session. If you have some time, you could give me a feedback so other people could learn as well. Yes, I intend to do it, but it's just that the more interaction it is, the better it is, because it's just blabbering to a computer screen, seeing yourself. I can continue doing that, but it's no fun. So yeah, I hope that's about it. I hope to see you in other sessions if I conduct any, and I hope you people succeed and reach your goals. Remember me in your prayers, and have a good day. Bye-bye.